Meantime, I want to bring in Dr. Patrice Harris. She's the immediate past president of the American Medical Association. Also with us, Dr. David Shulkin. Dr. Shulkin was the Secretary of Veterans Affairs under President Trump. To both of you, thanks very much for joining us. And Dr. Shulkin, does President Trump's push for events like the one we saw today and events that are be taking place in the coming days actually contradict medical guidance? How much do you question his judgment right now by what he's doing, given the fact that a week ago, just last Saturday, he was still over at the Walter Reed Military Medical Center in Bethesda, Maryland?
Yeah, Wolf, I'm very concerned about this. I think that this is a big missed opportunity to tell the American public the truth and to educate them. I think, unfortunately, he's showing all the signs and symptoms of CDS, which is COVID denial syndrome. Which, of course, COVID denial syndrome has 4 factors. One is you believe the virus is disappearing despite evidence that it's not. You believe that you're not infectious even when you haven't taken a test. You believe that you minimize the signs and symptoms of this illness despite the fact that we've had 213,000 Americans who have died of this. And, of course, this can be a very serious illness. And finally, you don't recommend social distancing so that this pandemic is allowed to continue and to continue to proliferate in the way that we're seeing it. So I'm very concerned about the way that this is being handled. And, unfortunately, as you said, we're seeing no evidence that this pandemic is going away in this country or, in fact, around the world.
You know, Dr. Harris, today we saw not only the president, but the vice president, Mike Pence, also hosted an in-person political rally at the Villages in Florida, a huge retirement community. A CNN producer who was there estimated just maybe 20% of the audience was wearing face masks. Based on the age alone of these attendees, potentially, correct me if I'm wrong, they're in a high-risk category. What do you say when you see a gathering, a political gathering like this?
Well, if we are entering a dangerous time, and certainly the science will be and is required for us to mitigate the spread of the coronavirus, but these are not either or activities, these are and activities. And so I was glad to see at the White House that a lot of folks are wearing masks. As you noted, there in Florida, not as many. But also social distancing is required, washing our hands, avoiding large crowds. And it's not just that the numbers are increasing, it's the timing. We are about to enter flu season. We are more likely to be indoors because of the cooler weather. Folks are getting tired and fatigued and are gathering in smaller crowds, but all of this increases the risk of COVID-19. So I'm very concerned. And I want people to know it's all of the layers of mitigation that science requires.
As you know, Dr. Shulkin, the White House continues to avoid answering questions about when the president actually last tested negative for coronavirus. Explain to our viewers why it's so critical to have that information. They won't even tell us if he's tested negative already.
Well, I think it's so important for us to know when the president first developed signs of having this virus, as well as when the virus became significant enough to test positive, because that's the way that you tell when and if it's safe for the president to go back out. Of course, we do recommend repeat testing. In fact, 2 negative tests. You should be symptom-free for 72 hours without being on symptom-mediating medications, and having 2 negative tests separated by 48 hours is the best evidence to suggest that you're not spreading the virus. But I think most important is that it's important to be transparent about this information with the American public. And when you're not transparent about information, people assume that you're hiding information. And this is all part of the erosion that we're seeing in the confidence of those that are in scientific positions and health professionals. And we need to have confidence in our health professionals during a time of a national pandemic.
Yeah, the president's physician hasn't held a media briefing on the president's condition since the president left Walter Reed, which was last Monday. He's issued a few very short statements in writing, but no opportunity for reporters to ask questions. Dr. Harris, today the president cited flare-ups in Europe and Canada, and yes, there are some flare-ups in Europe and Canada, but made no mention of the fact that the U.S. has had a whole lot bigger flare-ups, more than 50,000 new cases for 3 days in a row now, or that forecast models are now projecting nearly 400,000 American deaths by February 1st. What do you make of his continued claims that this virus will disappear, that it's just going away?
Well, I think the facts and the data really contradict that opinion. We are absolutely going in the wrong direction, and certainly those numbers are alarming. Now, those are projections, and Wolf, as you've heard me say so many times, we don't have to reach those numbers. We have the power, each of us within our own hands, to wear a mask, watch our distances, wash our hands, and avoid large crowds. And the other thing, Wolf, we need to do now that we are just entering the flu season is to get a flu vaccine. And particularly, it's important, and I want members of the Black and Latinx community to certainly become informed and get a flu vaccine, because last year, in general, over 400,000 of us were hospitalized. And if you look at data from the CDC over the last decade, Black and Latinx communities were disproportionately impacted when it comes to hospitalization for the flu.
All right, guys, thank you so much, Dr. Patrice Harris, Dr. David Shulkin. Always important having your views here in the Situation Room. Thanks so much for joining us.
Thank you.
Thank you.